Hello, it's good to see you both again. How are you doing today?
We've been doing okay.
That's good to hear. Why don't I take some time to talk to you alone and then we can all talk together?
That sounds fine with me.
Okay, why don't we bring Alex out to the nurse while we talk? Let me log in here and let's take a look at her chart. It looks like her weight is a little higher than last time. We talked at the last visit about some concerns you had around that.
Yeah, it's still been an issue. We've been trying to get her to eat the way that you said last time, but it's been hard for her. It's been so hard because kids at school have started to tease her about her weight. We've heard from a few teachers that she's been a little more irritable at school. I don't know if it's because of the teasing or something else. She's been more upset at home, and we notice that she's crying more often.
I'm sorry to hear that things have been so difficult. How long do you think this has been going on for?
About a month. We had a conference with her teacher last week. He recommended that she be put in the school's tutoring program because she's been falling behind the rest of the class. I'm worried. She hasn't had trouble with school before.
I can understand why you'd be concerned. Here in this clinic, we work as a team. Part of the team specializes talking through problems like this. They're called behavioral health consultants. They can talk to you more about what's been going on and discuss some strategies to deal with this. Would it be okay if I asked them to come in here and talk to you?
That would be great. While you're waiting, the doctor and the behavioral health consultant have a conversation.
Hello, my name is Dr. Smith, and I am part of the Behavioral Health Consultation team. First, let me tell you a bit about who we are and what we do. My team sees many patients in the clinic to talk about feeling worried, feeling down, stressed, or whatever is going on in your and your family's life. We talk together for 15 to 20 minutes. After our visit, we will share this information with the doctors and nurses in clinic to be able to together give you the best care that we can. I will also put a note in your chart, again, to help communicate to the doctors and nurses involved in your care. If you ever have any questions about that, feel free to ask. I work as part of a team with other psychologists and social workers, so if you're back seeing your provider on another day, you can ask to see whoever is here on my team as well. We are all happy to talk with you. You can set separate appointments with the behavioral health team too. So today I'd like to get a snapshot about what is working well and areas of difficulty, so together we can come up with a plan. Do you have any questions before we get started today?
No.
Okay, again, if you have any questions, feel free to ask them. So your doctor mentioned you are worried about your daughter. Tell me more about what's been concerning you.
She's had some trouble sleeping. I can hear her get up in the middle of the night. Sometimes she'll wake me or my wife up. It's been happening for a couple of weeks. At first we didn't think anything of it. We thought it might be the change in her diet. Most days she doesn't want to go to school in the morning. She seems worried about how the day is going to go, like what the kids are going to say about her. It's hard to watch her go through this. She says they tease her about her weight, and then when they aren't teasing her about that, they're teasing her about eating different foods than everyone else. And then she's tired from not sleeping through the night. My wife and I aren't sure what to do.
That must be difficult. How does she react to the teasing?
Her teacher says she cries a lot at school. She cries at home too. She's worried about her school too. She talks about it a lot. During dinner and while she's doing her homework. Sometimes when I'm reading to her before bed.
It's not surprising to see her trying to find ways to sort through the stress. Since the mind and body are so connected, many children with stress will develop physical symptoms like headaches or stomach aches. Have you noticed that?
Now that you mention it, she has been going to the nurse with stomach aches. I wasn't sure if she was faking sick to leave school or if she really was sick. I've had to pick her up a few times. The behavioral health consultant continues talking with the patient during this period.
Children will deal with stress in slightly different ways than adults. For children, they oftentimes have both physical and behavioral symptoms, such as the stomach pain and withdrawal that your daughter is showing. Just like adults, however, often the best medicine involves talking to someone so they can feel supported in learning some ways to deal with stress, like teasing from other kids. Let's bring her in, if it's okay with you, and we can help her feel heard and maybe teach her some new skills. One of the things kids can do when other kids are being mean to them is put on their smart armor. Smart is kind of like superhero armor that you can put on whenever you need to. That word can help you remember what I'm going to teach you. Just remember the first and last letter. S is strong and T is think. When a bully is being mean to you, the first thing you do is put on your smart armor in your mind and think strong. You can do this by taking a certain posture with your body. Here, let's practice standing strong with our bodies. So to wrap up, we've made a plan of Alex practicing putting on her smart armor. We will be in touch with the school to get some more information about what's going on and how they're dealing with it. You're going to keep noticing her behaviors and keep an eye on if things are increasing, staying the same, or calming down. For follow-up, we have a few options. We can see you after your next doctor's appointment, or you and Alex can meet with our team sooner in about 2 weeks to check in with someone from our team about how things are going. How would you like to follow up?
I'd like to come back in 2 weeks.